Good morning, this is Dr. Manik Chopra. I am an interventional cardiologist at Narayana Multi-speciality Hospital, Ahmedabad, and I specialize in structural heart disease interventions, TAVR, TAVI, TMVR, mitral clips, and other structural procedures. Structural heart disease interventions primarily now deals with valvular heart diseases. Uh, it all started with patients with severe aortic stenosis who were of a very high risk for surgery or inoperable risk, and these patients had no hope as such because symptomatic severe aortic stenosis, if not treated by aortic valve replacement, has a very poor prognosis. So there was a huge chunk of patients who needed aortic valve replacement, but open heart surgery was not possible. The transcatheter aortic valve replacement started. Initially, it was done on compassionate basis, and then it was found out that it's really doing well. It's better than leaving the patient for medical management. Over a period of time, the transcatheter aortic valve replacement was compared with surgical aortic valve replacement in all the risk categories like high risk, intermediate risk, and low risk, and it was found that it is safe and effective procedure, and many a times better than surgical aortic valve replacement. So it was a long journey which started in early 2000s, and it is a very structured journey, I would say, which began with the compassionate cases, then trials in high risk cases, and then intermediate risk and low risk. It is a standard of therapy nowadays in Western world. Of course, we know that most of these procedures are sponsored by the government or by the insurance company in that world, and now we find that transcatheter aortic valve replacement is almost matching surgical aortic valve replacement in numbers in many countries. Regarding the Indian scenario of transcatheter aortic valve replacement, it has been few years that it has been in India, but nowadays it is gradually picking up fast because as I told, it's a minimally invasive way to do a procedure, and especially in patients who are at high risk of surgery. It's typically done under local anesthesia without giving any incision over the chest, without putting the patient on a heart-lung machine. It's done through a small incision in the leg, 1 centimeter, and you can pass a catheter from the groin which reaches the heart. You deploy the valve and come out, and the patient remains in some observation for 8 to 10 hours, is out of the hospital in 24 to 48 hours, and joins routine activities in next coming 4 to 5 days. So it's quite safe and simple in comparison. I mean, in comparison to surgery. My journey with structural heart disease interventions started with my training for the same at Riggs Hospital at Copenhagen under Dr. Lars Sondergaard, who is a pioneer for structural heart disease interventions and have trained many people across globe. I joined Narayana Multi-speciality Hospital, Ahmedabad, and since mid 2019, I have proctored and done more than 400 plus transcatheter aortic valve interventions and other structural heart disease interventions, and this spans across 16 countries, more than 50 cities, and around 130 plus centers. I am proctor for most of the transcatheter heart valves available in Indian and international market. Main challenges at present for transcatheter aortic valve replacement therapy is probably lack of expertise reaching to almost all the hospitals. So, and second is the cost of the therapy. So, when you develop a center for such therapies, initially you would need some sort of expert who would probably support the cases, and then after few cases are being done, the center becomes good to go. So that is one challenge, and second is the cost of therapy, which is slightly on a higher side, and most of the times it has to be beared by the patient or the patient family, which is quite different than the Western world, in which the cost is beared by mainly the government or the insurance company. So that becomes a bit of challenge. So the transcatheter therapy is not only limited to the aortic valve, it is also available on other valves like pulmonary valve, tricuspid valve, as well as the mitral valve. It's just not replacement, it is also available for repair. So if we talk about mitral valve, you have transcatheter mitral valve replacement in patients who have previously implanted surgical valve or previously implanted rings or extremely calcified mitral valve. Also, we have repair systems available like Mitra clip and also Pascal, which are clips in which can be used to treat severe mitral regurgitation. Over a period of time, uh, TMVR systems are developing for native mitral valve disease also, but that would take some time to reach. Now, when we talk about the tricuspid valve, there are many companies working for replacement of the tricuspid valve in patients with severe tricuspid regurgitation by transcatheter way, and of course this will also take some time to reach. At pulmonary position, transcatheter pulmonary valve replacement is an established therapy now for the patients who had previously received RV to PA conduits or who have a valve in that position. Of course, patients with who have been operated earlier for the pulmonary valve in a situation called tetralogy of Fallot develop severe pulmonary regurgitation over a period of time, and these patients also can be treated with transcatheter pulmonary valve replacement nowadays. We at Narayana Multi-speciality Hospital, we have a team of interventional cardiologists, cardiac surgeons, anesthetists, and many other specialists who see each patient in a combined manner to understand what would be the best way to treat this patient. And we take pride in treating patients with the transcatheter aortic valve replacement not only from Gujarat but also from adjacent states like Rajasthan, Madhya Pradesh, Maharashtra, and also from outside India like Kenya and Bangladesh. We have a lot of firsts to our credit. We were the first one to do transcatheter mitral valve replacement in Gujarat. We were the first one to do mitral clip procedure independently done in Gujarat. We were the first one to do transcatheter aortic valve replacement with cerebral protection device in Gujarat. Again, we were the first one to do the transcatheter aortic valve replacement and a bicuspid valve, and in valve and valve situation requiring valve fracture in Gujarat.